I'm Bruce Darrow. I'm Chief Medical Information Officer and Senior Vice President of IT at Mount Sinai Health System, and I'm Associate Professor of Cardiology and Medicine at Mount Sinai Hospital. The new Masters of Healthcare Administration program is really tailored to the new needs of today's professionals to make sure that they have the information that they need to bring confidence and knowledge to their jobs. Having an MHA from Mount Sinai will prove to your prospective employers that you are serious about your future in healthcare leadership and that you have gone through a rigorous process of making sure that you've been trained to think about the questions for healthcare that we're going to be facing in the future. Mount Sinai's MHA program is unique because it rests on the clinical excellence that Mount Sinai has had for more than 100 years and our ability to bring new research and clinical excellence to the care of millions of patients who come to Mount Sinai for their care every year. Having leaders as teachers for the Mount Sinai MHA program really sets the bar for quality because it means that you're not getting a secondhand story. You as a student in this program will be hearing from the people who are trying to make change in the healthcare environment, both at Mount Sinai and on a national and international basis. My teaching will be focused on the use of technology in healthcare and healthcare delivery. Most of the goals of today's healthcare leaders, whether it is to improve safety in our healthcare system, include the quality and outcomes that patients get, improve their experience from the healthcare system, or make the healthcare system more effective and efficient, are going to be rooted in technology solutions. Students want to learn from people with experience, not only knowing the material, but actually living it. And so when students come to me and they want to learn about how you use technology in healthcare, I can bring the perception of somebody who is working with technology companies, working with systems, working across the organization, and then being the person who is actually using that technology when a patient is sitting across from me in my office. With our presence across the metropolitan area, we draw on a population of patients that represents the entire microcosm of what America is in terms of their educational background, the languages they speak, their cultural preferences. All of this is reflected in the care that we give, the student body and professorial body that we recruit, and the lessons that we teach. Solving the healthcare leadership challenges of tomorrow is going to require a new generation of healthcare leaders that are bringing expectations not only from within the healthcare system, but within the environment of the real world, where technology is used on a much more frequent and casual basis to solve the problems of today.